Hi, thanks for being here. My name is Nancy Beale. I am the VP of Clinical Informatics and Chief Nursing Informatics Officer at Catholic Health in Long Island. And I'm here to share with you our experience with OneView and how we have redefined the inpatient care experience leveraging OneView tools. Little bit about Catholic Health. We have 6 acute care hospitals and just over 1,900 hospital beds and about 3,650 physician partners. So at Catholic Health, like many healthcare organizations, our varied 6 facilities for inpatient care, many of them have outdated infrastructure, a lot of challenges, but we had this opportunity to redefine what care was going to look like with a new patient care pavilion that we put up at our Good Samaritan University Hospital. So you can see here some pictures from the outside of the building and inside lobby. It was a really exciting opportunity to bring some fresh technology and fresh opportunities for the people of Long Island. We said we really want to reframe the room and really look at the inpatient stay being one of the most vulnerable and high-stakes moments when a patient comes to the hospital. So we looked at the conflict, right? So patients want clarity, control, and connection, and staff need to make sure that that technology supports care without adding extra complexity. So the hospital room has become a digital center of patient engagement. So our solution, working with OneView, we have a single intuitive interface to access everything related to the stay for the patient. So the goal is not more technology, but simplicity and continuity. So you can see here, patients can access their patient entertainment, right? But we have one unified ecosystem that brings together the other pieces and parts of the inpatient stay that the patient needs to engage with. So the first thing you see here is visibility into who's caring for the patient, and that's through an interface with the Epic Care team. And there's hospital information, access to language, different languages support, and the digital handbook really replacing what used to be that paper that you gave to the patient about my rights as a patient and what I need to know about my inpatient stay. That's all digital. Control and comfort is really the most important piece for us to make sure this is a positive experience for our patients. So we have integrated our patient meal ordering. We use Seaboard as our nutrition system, and so we interface both Epic and Seaboard to make sure that we have the right information about the right diet for the patient, and the patient is only presented with those things that are applicable to their ordered diet. We have, as I said, the entertainment system. So at our hospital, prior to this integration, we were still charging patients for television. So this was a huge step for this community to say, wow, like I can just get all these movies for free? That seems pretty basic, but you would be surprised what a big positive influence that has had on our patients. And then there is a possibility for environmental controls. So room automation using the bedside tablet. So we also can use this hub to drive patient education and prepare the patient for discharge. These are important steps in the journey, but also facilitate throughput in the hospital in a positive manner for the patient and an efficient manner for clinicians. So what are the gains? From a patient's perspective, there's greater transparency. They have more information about their stay available to them, and they also have the ability to place these digital requests. For the nurses, there are fewer repeated questions, fewer interruptions for non-clinical tasks because they have information right in front of them. The platform complements workflows rather than competes with other platforms. And so it improves the experience, reducing friction rather than creating more friction. So under the hood, we are not yet live on all of these integrations, but we are on a journey to turn on these integrations. So we do have in our new patient care pavilion virtual nursing care AI as a platform, and we're looking forward in our journey to integrating that with OneView, as has been done at other health systems. As I said, dietary nutrition, capabilities of integration for telephony, of course, the Epic EHR, and translation services. All of these things can be orchestrated using the OneView platform. This is an ecosystem that is designed for us to be able to grow as a health system, grow our not only footprint of how we serve our patients, but also the integrations as OneView continues to grow and innovate. So the integrated camera hardware enables future use cases like virtual nursing, as I said, remote monitoring, and virtual rounding without requiring new construction or hardware. So we can leverage that with OneView. Clarity in how we communicate with patients is really important. We also preserve their dignity, right? Providing things at their fingertips as opposed to really feeling reliant to always push a call light for help or ask questions. The inpatient experience is defined not only by the clinical excellence, but that clarity in communication and dignity. So one of the things that I'm very excited about that I just learned about today is a voice activation. So today we use pillow speakers to control the TV integration with OneView. And in the future, OneView is working on voice activation, and we're looking into leveraging some of the existing technology and hardware that we already have in the room to do that. So that really demonstrates not only the innovation for the OneView application, but also, how you're setting that infrastructure for the future as you grow as a health system. We also have implemented the OneView platform at one of our other hospitals. So what I like about that is it provides us flexibility to be able to, leverage the state-of-the-art configuration in the new patient care pavilion, but also support some of the older infrastructure that we had in place, where we have an all-in-one hardware that is connected, hardwired, that allows us to do some of the very same functions that you see here. So all in all, that's a pretty quick overview of how we use OneView, and we work with OneView as partners to continue to evolve our patient experience. Some of the initial feedback that we have had from patients and staff is, this is so easy. This is really future technology. It's the kind of experience that you get when you go to a 5-star hotel, right? So they go in the patient room and they're able to have that same kind of familiar experience, and it's modern, right? So it's been a real positive for us. On the staff side, There was a lot of angst early on, feeling like, oh, I'm going to need support. I'm going to need someone at the elbow to show me how to use this. We had people there when we went live and they said, oh, that's it? This is easy. So it really helped our staff to be able to understand and accept the technology as well as support patients in their journey. Happy to take any questions. All right. One of the biggest challenges we had with nursing staff really was just that angst about new technology. They were afraid it was going to require them to have a lot of training and at elbow support. And what they found was, we provided them a tip sheet. We had people there on the day that we went live, and they said, that's it. And I think once they actually had that first day hands-on experience, they realized this is actually going to help me care for patients as opposed to be one more thing that I as a nurse have to do. And I think that was the concern that they had. Oh, success metrics, KPIs, right? Well, we're certainly looking at patient satisfaction scores. And as I shared some of the anecdotal feedback that we had both from staff and patients, those are things we are tracking. So we will definitely be, this is a new journey for us with our new patient care pavilion, but definitely be monitoring the Press Ganey statistics that we collect on patient satisfaction. I think for the future, as we turn on the virtual nursing integration, one of the things we'll also be looking at is not only satisfaction, but throughput, right? So throughput, decrease in number of call lights, right? So those are additional metrics once we turn on that virtual nursing in the patient rooms. We are doing virtual observation through the same infrastructure. So that's already in place today, but the virtual nursing is where we'll start to really monitor and measure throughput metrics as well as patient education and readiness for discharge. Good questions. So currently, the integrations that we have live, we do have Epic integration live. We have the Seaboard meal ordering integration. We have the patient entertainment system live. Those are the major ones. And then the virtual nursing, all the technology is there. We're waiting for the operational plan to activate that. So, but that'll be next. So our current Epic integration pulls the care team and the ADT information, patient identifiable information, as well as the meal ordering, right? That comes with the patient order to Seaboard for the patient's prescribed meal, right? Or diet, I should say. As far as future integrations, as we progress, down the journey with integration, we'll likely be including the patient education components. I will say I have done that elsewhere with OneView, where we also had patient integration or patient education integrated. Other questions? Yes, we do have a plan to expand to the other facilities. And as I mentioned before, one of the exciting things about this is while we have this opportunity with a brand new facility to, put up the latest and greatest, smart TVs and other features and functions, We do have it live in one of our facilities that is not as progressive and has older infrastructure. And so the appealing part to that is you can phase, right? You don't have perfect is the enemy of good, right? And so being able to have an integration, really starting with the patient entertainment would be probably the biggest bang for the buck. The Epic integration's already done. So there's nothing net new to do there. It's really a matter of getting that hardwired in some of those older facilities. But OneView is really works with you and is very good about drawing out the plan and understanding what the impact is going to be. I would say that if I had my druthers, of course, I want that solution. The premier solution at every facility, but not all facilities, A, have funding, B, have the right infrastructure, and so sometimes you have to fix the underlying infrastructure in those facilities before you can actually begin to do this kind of integration. But it is possible. We've done it, right? And we do have, so we have 2 facilities that are live now, and we do have other facilities on deck to be installed. Everybody wants it. It's a matter of getting in line and getting the work done that serves as the foundation. Other questions? Great. Thank you.